Hi everyone, good afternoon and welcome to the Epilepsy Foundation of Connecticut Fall Webinar Series. This is Monica Anzalone. I will be moderating today's webinar. For the purposes of sound quality, everyone will be in the listen-only mode, and we welcome you to use the chat icon at the bottom of your screen to type your questions, and all questions will be answered at the end of the presentation today. Usually our webinars focus on epilepsy and the person living with epilepsy. Today, we're going to be shifting our focus a little bit to caregivers, and we'll be discussing coping strategies to help caregivers to be the best that they can be at caring for their loved ones. So I would now like to introduce our presenters who will be joining us from the Drazen Law Group, which is located in Milford. Attorney Franklin Drazen of this law group practices elder law, focusing on estate planning, special needs planning, life care planning, Medicaid eligibility, business, and tax matters. And then we also have attorney Rubin joining us as well from the Drazen Law Group, and he helps his clients deal with tough issues such as death, incapacity, disability, special needs, Social Security, asset protection and taxes, and provides assistance in the best and least stressful way possible. He is an active member of several organizations that reflect his passion. So I would now like to turn this over to our lawyers here this afternoon. Welcome and thank you.
Thank you for having us. So I'm Stephen, this is Franklin to my right. And I guess since this is being recorded, wherever you are, good morning, good afternoon, and good evening. So today we're going to talk about caregiving and things caregivers need to be aware of. Both Franklin and I are certified elder law attorneys by the National Elder Law Foundation. And elder law includes planning for people with disabilities and special needs. And as part of that, we work a lot with caregivers. We both have experience coaching caregivers, and we've both been caregivers, and I still am a caregiver, and Franklin's about to become a caregiver again. Because he's making the sacrifice not every one of us would be willing to do, and allowing his mother-in-law to move in with him. So we have experience with caregiving, and most family members do. Right now, there's 52 million informal caregivers in this country, most of whom provide care to someone age 20 or older. There's 34 million adults who do the caregiving to persons over the age of 50. And there's 8.9 formal caregivers for people with dementia over 50. There's a lot of studies out there about who caregivers are and how much it's worth. But over the last few years, all of those studies have come back with the same. Family caregivers outweigh insurance-provided caregivers, Medicaid caregivers, sponsored caregivers, and private pay caregivers by almost $120 billion. The amount of time spent by family caregivers is $120 billion greater than anything that is paid for in this country. So family caregivers are truly the #1 source of care. And as a result of that, most caregivers end up facing a lot of consequences. As caregivers, we all know that we face some of these things. A lot of them are mental. Mental health is a big loss to a caregiver. We don't spend a lot of time focusing on ourselves. When was the last time we went out for a meal on our own, or went out with a friend, or did something with somebody else that we wanted to spend time with? Because when we're a caregiver, we're generally focusing on the individual first and what their needs are and whether they're in a safe place. We have physical disabilities as a result of caregiving. Now, the disabilities aren't necessarily things like because we're getting sick or hurt, although that is a significant risk of caregiving, but sometimes we're just not taking care of ourselves. We're not going to the doctor. I was talking to a client yesterday who hasn't had their own doctor's appointment for 3 years because they've been a caregiver for so long and they couldn't get any backup. There's a lot of financial toll for caregiving. There's some new numbers that just came out a couple of weeks ago that said family caregivers end up losing significantly in their own finances, and there's 5% of them go bankrupt because they use the money to provide care for the individual rather than for themselves. They take fewer promotions, so they're costing themselves money at work. They're not working full-time or incapable of working full-time because of the level of care that they provide. And there's a big social loss there. We lose our social groups, our networking groups, and we lose our friends. We see a lot of lost relationships and a lot of fighting amongst relations. A lot of parents who are being taken care of by a child because the other kids aren't willing to do it. Well, a lot of those situations, we'll see the spouse start arguing because they're not getting the attention that they want in the relationship anymore because now their spouse is taking care of their parents full time. So there needs to be a balance when we do caregiving. We need to have some protection from these consequences and create a good support network. I think all caregivers are superheroes, and essentially, because most caregivers give up their time, they give up their life, they give up their freedom and their support.
And often that's 24/7, 365, and it's the continued effort that's required for many caregivers that really launches them into the category of superhero.
And because of that, caregivers don't get appreciated. A lot of people don't understand what the work of a caregiver is. They don't get the support from other family members because people think it's easy. How hard does it take care of a family member? Well, it's difficult. It's time-consuming and it's challenging. So as caregivers, there's some things we need to be aware of and things we have to start working on. The first one is we have to give ourselves permission to take a break. There has to be a break from being a caregiver because you can't do it 24/7, 365 and never take a break at it. I had a case a couple of years ago where a spouse was the caregiver for his wife, and he ended up being diagnosed with cancer while providing her full-time care. And he didn't think he could get the cancer treatments because he wanted to continue providing care for his wife and didn't think anyone else could do it. As unfortunately happens, he ended up passing away first because he didn't take care of himself. He didn't take a break. So you have to give yourself a break. You have to take care of yourself. And there's a lot of different ways of doing it. You can get professional support in the home. There's some new grant programs that are designed to help people pay for private caregiving or respite care. They're not generous, they're not easily accessible, but there are some programs out there that are worth looking at. Psychoeducational support, talking to someone, getting some assistance on how to be a better caregiver, as well as getting some assistance just being able to talk. Working on skills training. And we all want to improve how we do certain things and making sure we take the time to learn different things, manage different behaviors and how we're going to handle things. Self-care. I think relaxation and self-care is a huge thing. As a caregiver, we need hobbies. And we have to have a hobby, and it has to be something you want to do. Because you need to take time for it.
And there's a couple of other things in there that I want to just point out is that taking a break is getting an hour or two away just to even get, for women to get their hair done if that's what they want to do, or for people to get some exercise. All of those things are essentially beneficial, and they lead to, a renewed sense of energy and more ability to deal with everything that comes up as a caregiver.
Right. And that gets into, also making yourself more efficient by designing the rooms and the environment you're providing the caregiving in a way in which it's easier for you to find things or get things that you're going to need, especially things you're going to need access to. Because you have to look at caregiving from a different perspective. And one of those ways to look at it is, what's life without you? If you don't take care of yourself, how can you take care of somebody else? Because if you're not around, their situation will never improve. If you're dead or disabled because of it, it just doesn't improve. And then they're left without the most knowledgeable and caring advocate that they've had throughout the disease or throughout their life. So we want to make sure that the person who's doing the care is really going to be taken care of, that they're really going to be able to take that comfort level. My mom was sick at one point, and one of the things she told my sister when we were working as caregivers was that we had to get away because she needed our help, but she also couldn't have us burnt out, and that she'd be okay for a little period of time. So doing those things is a big part of being a caregiver, because we have to constantly go back to the same thing of spending a little time taking care of us. So caregivers need to get help. It's one of the #1 mistakes that I made was we never accepted help from anyone. And it's as I go through this a second time now, it is a mistake I am not making again. I've learned that I have to be able to accept help. I can't go at it alone. And alone being relative, because yes, I have a sibling, but it's still alone. It's just, we call it us against the world. But the reality is when we get assistance from other friends and family, it makes us feel better. It lowers our stress levels, and it reduces our load on everything we have to do. And we want to lower our stress levels. Stress kills. I want to avoid that. And we can get a lot of help from professionals. Certified elder law attorneys, care managers, doctors, and clergy can help us in a lot of different ways. There's different things we can do. The biggest thing that can help someone is starting to get a plan going. Getting a plan of who can be the backup caregiver, how we can get care in if we're not able to do it, the contact information for people in emergencies, and making sure we have everything structured in the right way. Knowing what community support groups are available and which friends really are willing to help when they say, hey, can we come and help you with something, and which ones are just saying it to say it. And even if they just say it and don't mean it, say yes anyway, because most of them will still end up doing it. Take the help when we can get it. We don't want to settle as a caregiver. And as part of that, it means we don't want to just cope with things, because life is essentially a cycle. And what happens is we have an event or an occurrence of something, and we start coping. Well, then what happens next? We're going to have another event, and we're going to cope some more. And we're going to have another event, and we're going to cope. If we keep looking at this in a circle, it's basically a spiral. And we're starting to spiral downhill as we keep coping, because we're losing things. We're losing what makes us us. We're losing our ability to function. We're giving a lot of things away that we want to hang on to.
And coping is about focusing on the present. It's not about getting ready for what you're about to face in the future.
We want to prepare for things. Preparation is truly the key of being a successful caregiver and taking care of ourselves, as well as our family member and loved ones when we're trying to do it. Because the lack of preparation always leads to a crisis. And when we have a crisis, it's going to lead to a faster decline. It's going to cause an increase of stress, and we're going to spend more time and more money on it. So we want to avoid the crisis. We really want to have is transitions. Life can basically be divided up between crisis and transition for a lot of things. And the difference between them is very narrow. When I started thinking about it a while ago, it was new to me, but a crisis or a transition are the same thing. It's this event, it's the same occurrence, it's something that's going on in our life. But the difference is how we react. In the crisis, we're chickens with our head cut off. We don't know what we're going to do. We're not responding to anything. We're just kind of running around to the next emergency rather than coming up with a plan. In that transition, we have a plan. We know what's going to be next. We know what the results are going to be. We know how we're going to handle a situation. There's a ton of advantages to having that plan in place. One is we're not stressing because we know that there are different options and this is what we'll do in these situations. But another big part of having that plan in place is that we get to focus. And we get to focus on our loved one. It shouldn't be when they were in the middle of the emergency. If it's a hospital emergency and they're in the emergency room and then they're going to be admitted, that we're focusing on what next. We should be focusing on making sure that they're being taken care of. Because what next, we should already know what we're going to do. We should know what our options are, rather than just be winging it all the time. So generally when we do a plan, we want to have different ones, because what plan ever goes to work? Dad loved the A-team, so when I was growing up, I always say I love when a plan comes together. But which one? So I always have multiple plans in every situation, and that's really what everyone should do. And we want to have a plan A. When everything goes as it's been going and it looks like we're going to stay on the same path and things are going really well, that's the one plan we always hope is going to happen. We want to have a backup plan. We want to have a plan B, because if there's going to be more that care and being required or more things that we have to handle or something else is going on, we want to have a plan for that situation. We want to have a plan C. We want to have a plan for the worst possible scenario, where the quality of life is getting too expensive to maintain, where we have difficulty with everything, where nothing is working from a care standpoint, and we're at the end of the situation where there's just fewer and fewer options. Because we want to know what those options are and have a plan for when they might go into place. So because when we plan, we get a lot of benefits of it. We avoid the crisis. We allow for transitions as our needs change. We have clarity on everything. We reduce fear, anxiety, and really fear and anxiety tie back to stress. And we want to have better outcomes for ourselves and for our patients and our family and our loved ones. We want to make it easier on them, and we don't want them to feel the stress that we're feeling. Because when we get stressed out, most of the time our loved one's going to know we're stressed about something. So we want to make it so that they don't feel that we're stressed. And by having that support in place, we reduce that stress, reduce the risk of depression. We have a better knowledge of the things we can do to help our family and our loved ones, because we've actually planned for it. We've learned that there are these other options out there that no one had ever told us about before. Now, when we do have to cope, we're a lot more resilient for anything that's going to come up, because we know that what the options are. So we're making decisions from an educated point rather than from the heels of our feet. We improve the continuity of care. We make sure that the care outcomes are smoother and that there's a better path for other caregivers to help in situations when we're not available. And because of this, we reduce the amount of crisis situations that result in phone calls and expenses. Because we can't know what we don't know. And this is one of Franklin's sayings. He loves saying this, because and it's true, you can't know everything. I like to think I do, but I don't. So we have to get professional help sometimes. And professional help seems like an expense, but it's not. Professional help is a bargain. Ignorance is where it becomes expensive, because that's where we waste money and we throw things away and we sacrifice for things we didn't really need to sacrifice for.
And the quality of care the loved one gets may not be as much as it could be if we don't utilize all of the resources that are available.
And we want to utilize those resources. We want to utilize whatever programs might be out there to help, or whatever legal documents we might need, or other sources that we can use to help. Because having those things prepared and having things done is a lot easier than when the crisis occurs. You know, Franklin and I were talking about a case earlier today. I had someone come in yesterday, and they're in the crisis, where they're in an emergency situation, and now they need to do a plan. The problem is they don't like what the options are. They want the options that they would have had years ago, but that don't exist anymore because they waited so long. The more we wait, the fewer options we sometimes have. And when we don't have those options, we might not like the outcome. So by getting things in place and learning the things we don't know and working with people who do know those things, we get to a place where we don't have any unnecessary work. We avoid mistakes in the plan, and we avoid unwanted outcomes. Because the outcomes might not be what we want, but having a choice in outcomes is still better than not having any choice at all. So we want to have this plan together.
If you don't relieve the stress, you're going to end up with increased health problems. Now, these are generally health problems for the caregiver that we're talking about here. But it could also mean that when you're under stress, the quality of care you give to your loved one isn't the same. But I think people recognize that part of it, but they don't recognize what the impact of living with that stress does for them. And so that's usually the first thing we address with potential clients when they come in to see us. Stephen mentioned about the disruption to relationships, and I just want to add at this point that it's important to have friends and to maintain relationships, and it doesn't always matter what you do when you get out of the house. Just having a couple of hours to go shopping and to have a chance to think about what you need to be doing in the future can be very helpful for people too.
I know you see this a lot, and so do I. What happens when we see spousal caregivers or we see sometimes child caregivers? Can you talk about the dichotomy of being a family member versus being an employee?
Well, what I tend to notice is that the nature of the relationship changes. I had a woman that had come to see us and swore the husband was never going to go to the nursing home and that she was going to take care of him. But because of the progression of his condition, he was admitted to a hospital for about the 15th time when they told him that he had to go to a nursing home. And the next time I saw the woman, I asked her how she was doing and how her husband was doing. And she says her husband was doing great because he's getting the care level of care that he needs, and he hasn't had to go to the hospital to get his care. But she also said her relationship with her husband improved because while she was giving care, she had stopped being his wife. They hadn't even had the time to talk about the family and what was going on currently, let alone reminisce about what had gone on in the past. And so those relationships do take a hit if they're not maintained. And your quality of life is just as important. We've stressed that a couple of times in the presentation today, but it's like maintaining a car. It's going to operate better if you do what you're supposed to for the car, and the same thing with caregivers. And I want you to know that you don't have to be, if you think of yourself, you're not being selfish. A lot of people think they can either be selfish or selfless, and you have to be in between both of those things. And you have to think of it as investing in your ability to provide the kind of care you want to provide going forward. You need to have a backup plan, and this where we want to emphasize that you need to plan ahead of time. You need to do your homework, and a lot of times that will mean finding someone that does know the things that you don't know. And that's really where some care managers or elder law attorneys can be very helpful, particularly if their practice focuses on providing care and helping people discover how they can fund it. You need to investigate your options. But if you don't get guidance from a professional, what I find is that people end up spending hours and hours researching something that we subsequently tell them they're not going to be able to utilize for whatever reason, and that they could have been spending that time better doing something else. So you want to be guided in what you do while you're doing your homework. You want to investigate the options, and then you just want to see how close do these options help me with respect to all the goals we have for giving the care and the other life goals that you have. The time to do structural repairs to a home isn't when your loved one is recovering someplace and waiting to be discharged for the modifications to be done. You want to have the modifications done before they need them. And you want to have supports in place ahead of time, because having a little bit additional support for an individual that needs some care ahead of time is better than dealing with the result of an accident or a crisis when they do start to need the care because you didn't have it available or in place. And if you work ahead of time, you can have the time to check references, to look at facilities if some of the care is going to be given in facilities, and learn which caregivers in your community provide a good service at a reasonable cost and are reliable, that their caregivers show up or they get replacements for them. If you're having an outside caregiver come in and they don't show up half the time and you're trying to get to work, that's usually not a good thing. So you want to make certain that the people you're working with are going to be reliable. And if you get a caregiver that a family member doesn't like, if they need an outside caregiver, you have time to replace them if you start the process earlier. You know, no one wants to lose control of their life. And that's one thing that people fear, particularly as we age or our disabilities become greater. And so we want to be cognizant of that. So we want to get input from our loved one when it's appropriate. And what we mean by appropriate is that we don't want people making bad decisions. So if someone is refusing all care and it's quite obvious that they need the care, well, that may not be a good idea. They may not be realistic and may not be able to face the situation they're in, and as a result of it, their advice may not be appropriate. So control, and I think it's important to know that the psychologists tell us that control is really accomplished by exercising choice, because in most of life, we don't have control over the outcomes. We only have control by the choices that we make. So when you get to a place and you delay your planning, you're by nature going to give up control. So you want to also structure your choices for a loved one, because if the loved one's not safe at home and you give them the choice of getting help or not getting help, they're likely to choose not getting help. So what you want to be able to do is say, listen, these are the two things that we can choose between, because you can't be home safely by yourself. Now we can have someone come into the house, or we could change where we live, and we could live, let's say, in assisted living or something like that. So, and that allows them the sense of control, because they're getting to pick between the options which you've made certain are safe, because you're framing the choices. And one of the terrible penalties of letting a loved one make bad decisions is that you regret it later on if something bad happens. So you don't want those choices to be bad. Most people don't want to have their loved ones suffer the consequences of what is likely to happen. You know, it gets to be in many situations with degenerative illnesses that you can see the person, it's like a train coming from the other end of the tunnel, and a person, and your client walks into the tunnel, and you know they're going to get run over by the train, and so the outcome is very predictable. So make certain the choices are appropriate choices that you're giving them. Now, losing independence hurts. Recognizing, and we know a lot of people value their independence, and the reason why oftentimes they refuse support is they think of support as taking away their independence. I always tell the people, the clients that we work with and the families, that supports promote independence, because without them, you're likely to need an increased level of care down the road. They're keeping the person at home oftentimes, when the choice might be having them in an outside setting like a nursing home that they wouldn't like. And if you view it that way, having a support becomes something that's positive, not something that's, taking away your independence. So maintaining a balance between having a safe environment and supporting independence is difficult. So you have to work at it. And what may be appropriate now may not be appropriate next month. So you always have to factor in the loved one's, deteriorating health or mental capacity. So just be aware of that, because a person may be all right at home, even though you'd like them to have a little bit more support, but there may come a time when that's not going to be appropriate any longer. A lot of times people want to give a credence to what they think their loved one wants, and particularly when they don't have an opportunity to discuss it, or the person is under a lot of stress themselves. And I always say, which loved one are you listening to? All right. Are you listening to the one that has all the stress, is facing the situation, doesn't want to recognize it, is afraid of their loss of control? Or are you talking to the person from 20 years ago? All right. And when you listen to that person, it's very easy to listen to that person, even though we want to listen to him 20 years ago. Just ask yourself, what would mom or dad or whoever, my brother, have said 20 years ago if he saw somebody that needed a lot of care and wasn't getting it? So in essence, would she have said, your loved one have said, gee, that's nice, Mrs. Smith, the woman who's, needs the help, her children's letting her stay at home alone, even though she can't get safely around the house, prepare her meals, bathe herself, or remember to take her pills. And if they think it's okay that she wanders around the neighborhood and has to, get picked up or goes into dangerous areas. And the answer is they're probably not going to say that's a good thing. And when you're able to do that, you're able to trust your own judgment about what may be needed under those circumstances. Another thing I like to have people think about is what you do when you get resistance from someone that you believe really needs the care. And many times, particularly if we're providing care for a senior or someone that may have taken care of, so particularly a parent, and we know how much they valued their independence over the years, and they don't want anything done. And they say, well, mom's not going to let me, have someone come into the house, or mom's not going to allow something else. And what I tell them is, if you had a 7-year-old, what would you let them get away with? Would you let them jump up and down and cry and say they wanted to be able to, visit someone alone on a outside the house unsupervised? You'd likely say, no, you wouldn't. So, and the same thing applies to the loved ones, regardless of their age. So, and what's oftentimes driving our loved one is really fear and a reduced mental capacity or resistance to change in face of their illness. can oftentimes be the reason why the loved one doesn't want the support. And oftentimes, if you're getting resistance, the loved one isn't always as powerful as they think they are. If you want to, the way most families work is someone has to be, or other units, someone has to be in charge. And that's a position that, as a caregiver, sometimes you need to be willing to accept, because you only have the power if you use it. Oftentimes, people are trapped by the way they've thought about things, for their whole lives. When it comes time that someone needs support, and that support is going to cost money, oftentimes people are afraid to say, to spend the money. And I think it's helpful to think, that when you put the money away, you said you were putting it away for a rainy day when you needed it. And generally, supports are what you need to help maintain the quality of life in many situations. And once you understand that now that this is the reason you put the money away, so that you would have it when you needed it, makes it a little bit easier to put the supports in place and to spend the appropriate amounts to get the care. Okay. The best advice is usually the cheapest advice in the long run. So whether it's about a care manager or it's about an elder law attorney, it's easy to think of that as an expense rather than an investment. All right. And attorneys cost, but it's in most of our situations, even when we're giving help about how to give the care and putting documents into place to allow someone to be able to help the loved one when they need it, we're still able to show families ways that they can save dollars that they weren't aware of. So, and when we see a family that tried to go it alone and didn't get the good advice, it's almost always because they made a mistake that could have been avoided if they had good advice in the beginning. So, and you have to be careful of who you take what kind of advice from. If you're dealing with people that are in the business of helping people, they went to school to help people, like social workers and nurses, oftentimes we choose to believe whatever they say about areas they don't have a lot of knowledge or experience about. Because even the social worker in the nursing home doesn't really know very much about the intricacies of Medicaid and public benefits or the grants that are available in the communities. And they tell people sometimes that things that are available and can be done can't be done. And if someone is in need of care in a facility, a lot of times you deal with a discharge planner. And I think that the name discharge planner is very appropriate because they get judged and graded based on how well they function in getting people out of the facilities as quickly as they can and finding another place for them. So you have to trust your gut in that situation. And if you think your loved one needs more care, you have to be able to advocate for them. And if you're not able to take care of them at home alone and you're the only source of care for the person, you have the right at a discharge meeting to tell them that the discharge would not be safe because you're not able to give the right level of care. And federal law prohibits them from doing a discharge if it can't be done to a safe environment with appropriate supports in place. spending money can actually save money. And supports for a loved one while they need relatively little care oftentimes prevents the accidents or the worsening of their health condition. And if you spend the supports early, oftentimes you can delay or eliminate the need for more expensive care like 24-hour care or nursing home care. And a life care planning law firm can help you understand how to accomplish the care that your family member needs and to how to fund it, whether it's with private funds or public funds, and how to protect assets if you're facing the need for public benefits like Medicaid in the future. So there's 3 rules I want you to keep in mind as a caregiver. One is you have to have the courage to face what a caregiver has to go through. But you need to seek clarity about what you need to do in the present and going forward. And a lot of times getting good advice and information, putting a plan in place gives you the clarity, and that helps you maintain your confidence, because if you're prepared for the future, you can face it with confidence.
All right, so I think now we should open it up for questions.
Okay, everyone, you can place your questions in the chat box at the bottom if you have any. And I do have just a question here. A lot of the clients that we have here at the foundation are parents, families that have younger children with epilepsy, and for some of them, they're pretty sick. And so the question we get is, how can we access any kind of respite care? And oftentimes for these families, respite care is just not available, especially for families that have like a decent income coming in, and that financial service is not available to them where they would have to pay out of pocket. So I don't know if you have any suggestions for those families that might find themselves in need of just some respite care.
Well, so for respite care, there's a couple of different options that exist at the moment, but it's based on situations. There are some grants available for respite care through the Agency on Aging and a couple of other organizations, but those grants are not guaranteed every year. They're getting harder to gain access to, and the respite grants are going to be short. Most of them are for a week. We've seen one large grant recently come out for one client that was from a different organization. That was actually a full month of respite care, but that was a rarity. Most respite grants are going to be for a short period of time. It's usually a couple of days to a full week of respite care at a assisted living or another type of care facility, depending on what's necessary. There's not any real supports through Medicare for respite stays at assisted livings or any other sort of care facility. And while technically there is supposed to be home care available in certain situations, it doesn't really work. The reality has been it never pays out enough, and it's not necessarily available. So unless someone qualifies for a program that actually will pay for it or can get a grant, there's no private insurance method or anything else that's really going to pay for the respite care.
Yeah, well said. I guess that is really just the position we're in here in Connecticut, right? Where there's just not that many.
We try to get our clients to recognize that paying for respite care is really an investment in good care for the person that needs the support. And a lot of times, if someone's likely to need benefit from being in a facility down the road, many of those kinds of facilities, like an assisted living facility, would allow someone to come in for, 2 weeks, 3 weeks, a month, a week, so that and just pay for the short time that they're there, because they view it as an opportunity for the family to get to know about the facility and the services that they have, and it makes it easier for the person to make the decision down the road when they do need that level of care.
And it's not just a Connecticut thing. For the most part, respite's been an issue nationwide. It's a newer form of caregiving. It didn't exist for a long time, and now it's starting to become a little more current, but it's not something that, like, the insurance companies are into paying for right now. It's not likely to ever be covered by health insurance. I don't think it's ever going to be covered by state or federal benefits, because there's a financial disincentive to them to cover it. It's money. And who's not going to take advantage of it if they could get free care for a short-term period to get a break?
People may be able to get some funding through a long-term care insurance policy if they have it. And even if their loved one, they're providing the care for their loved one, if they meet the requirements of the policy, they may pay for the care under the policy. And even if they don't, it may be, most people have 100-day elimination periods where they have to pay the expenses. And it may be that those days that are used for respite care could accumulate against the days of care, so you can help get to the 100 days of care that most policies require you to self-pay.
We do have one question here from one of the participants, and she's asking, she's facing a situation where it might make sense for them to pay a relative to care for a parent because this relative is not working. So any advice on going that route?
So there's a lot of pluses and minuses to paying a family caregiver
Or a friend.
or really any caregiver that's not through an agency. You have to have a contract with them, even if it's a family member, because the transfer and the payments to them is considered a gift for the Medicaid purposes down the road if there's ever an issue or anything else. So you need to document what they're going to be doing, how they're going to be paid by the, whether it's hourly or daily rate, and it has to be done by prevailing wage in the area. It's also a really important thing when you're basically doing that because you're essentially acting as your own care agency when you're hiring someone to do that. You have the issue of, withholdings. You potentially might want to look at getting insurances. So there's a lot of planning that goes into that beyond just having the family caregiver. And you want to have a backup caregiver too. No one likes care agencies. I've never had a client say, hey, I want to work with the care agency. They like the caregiver that the agency sends. But the advantage is, what happens if that caregiver gets sick for a day or gets into an accident? And we've seen that situation.
Yeah, we've seen it. But that made me think of my niece who owns a care agency outside of Boston. And I referred a client of mine had a family member that needed care in Massachusetts, so I referred them to my niece, and we had Thanksgiving one year, and she couldn't make it to Thanksgiving, and I ran into the person that I had given my niece's name to, and he said, your niece is the nicest person. Do you know she was taking care of my father on Thanksgiving? And I said, well, I know she wasn't at my house like she was supposed to be. So that's the benefit of an agency, is that they will, or they should act if a caregiver isn't there. Now, you may have, the problem can be you have to notify them that the caregiver isn't there, so because a caregiver oftentimes won't give anybody notice if they're not showing up. And so you need to be careful with that.
The shorter answer is yes, you can do family caregiving, but the best way to set that up is to have a plan. It's not just to say, hey, this is the caregiver and start paying them. There needs to be a written as well as known plan amongst the family members of how it's going to work.
And one of the things that our comments today probably illustrate is that things keep coming up all the time that the family can't possibly know about.
Or predict.
Yes, and so when we work with a family, we tell them that we're trail guides for them, and we have a program where when these things come up and they don't know how to deal with them, they can call us and take advantage of our experience with hundreds of families that we've worked with and the care coordinator we have on our staff, because you don't want to become an expert on any of this. You just want to know what you have to do for your loved one. And oftentimes people become paralyzed by thinking that they're going to go online and find out how to do this. And you learn some facts, but you don't know how to shape that into a plan in the best way you can typically. And that's why I tell people so often that you just don't know what you don't know.
Okay. And we do have another part to the question here, but we're kind of running out of time here. So I'm going to go ahead and say the question, and then maybe you can direct them to your email to discuss this further. They have a daughter that has epilepsy, and they've been advised to set up a special needs trust for the daughter. Is that something that you guys can help them with?
Yes.
Yeah, I'll talk about that. All right. We take care of that, and that special needs trust allows someone to receive public benefits while they still keep the assets that have been set aside for them. And that's the basic purpose. It also helps manage money for people that couldn't otherwise manage the money themselves. So we do quite a bit of that work over the last 10 years or so.
Okay, so that is something that you'd be able to provide more information. Should they email or give you a call?
Yeah, they're welcome to email or either
Okay.
one. We're happy to discuss it.
Okay. All right. Well, thank you both so much for your time. Your answers are so thorough and easy to understand, and I feel like you made a lot of sense in just your responses, even, in talking about setting up a care plan for a relative that is a relative. So we really appreciate your time, and thank you everyone for participating in this. This has been recorded, and it will be available on our website probably by the beginning of next week. And on behalf of the staff here at the Epilepsy Foundation of Connecticut, I thank everyone for joining us and taking time to be a part of our fall webinar series here today. Thank you.
Well, we're glad we were able to share this information with you, because we think it's very important to let the families know how to go about providing care for the family members.
Thank you for having us.
Thank you.